Hey you guys, this is Heath, and I am 3 days post-op top surgery today, and I have my gorgeous girlfriend here with me.
Hey!
She's gonna help me do my update video, because for part of it I wasn't really awake, so she'll probably be able to give you some better information about everything than I will. But what I wanted to talk about mainly was just kind of break down from my pre-op appointment to my actual operation, and then my post-op appointment. That was the following day. Starting with my pre-op appointment, we went to Dr. Raphael in Plano, Texas. He's at the American Institute for Plastic Surgery. So we went there to do the pre-op, and basically we did paperwork for that one.
Yeah.
Right?
Mm-hmm.
So they just had me fill out like a bunch of consent forms, kind of just showing that, I consent to the procedure, which was a double mastectomy with a free nipple graft. The first thing we did was we paid the deposit.
Yeah.
So to book a surgery with Dr. Raphael, it's a $500 deposit to actually book the surgery day. And so then whenever you get there for the pre-op appointment, you pay the remainder of it. So we did that. What else, Kim, did they go over during the pre-op?
They went over medical risks, if you have any family history of terminal illness, and just making sure basically that you understand, especially you since you haven't ever had a surgery where you've had the general anesthesia, that you understand the risk factors and the possible outcomes, that sort of, just a precautionary thing to, go over. They didn't talk too much about the actual procedure. That was more in the day of, I guess. So they didn't cover a whole lot of that. It was more paperwork.
Yeah, a brief overview for the most part, and then they gave like the prescriptions to be filled. So they gave us the prescriptions, which were, do you remember what they were all for?
Yeah, they had one, it was a general pain medication, and they had a muscle relaxer. They also had an antibiotic, and then a anti-nausea, like melting pill. You just put in your mouth and it melts away if you get nauseous, which we definitely needed that on the first day anyway.
Did use that.
So you fill those the day before surgery, after your post-op appointment, and before you come in for your actual surgery the day of, because you pretty much need them immediately after you get out of surgery.
So we did that. We went and filled those at the Walgreens that was right up the road. So, and then the surgery was scheduled for August 5th, which was our 4-year anniversary.
Yay!
So we decided that since I was going to pretty much be out of it for our anniversary day, we were going to go out with some friends for dinner the night before. And so one thing that they had stressed during that pre-op appointment was to make sure that we didn't eat past midnight, and just to get some good sleep. So we went out and we had a really good time with some friends.
Ice cream.
We did have ice cream. That was really good. And so I got some pretty good sleep that night. And we woke up and we were asked to be there an hour and a half before my surgery. The night before, they actually gave like a call, and it was from the people who were with how do you say it?
It was the anesthesiologist that called you.
Yeah, the anesthesiologist called me. And they asked me a lot of the same questions that were asked at the pre-op, which is, fine. They just wanted to make sure I wasn't allergic to anything, that I've never had any like bad negative side effects with doing that before, which I've never had surgery before, so I couldn't really give them too much information about that. But yeah, they did call and check on that. So the next morning, whenever we got up there, they pulled us back pretty immediately.
Yeah. Mm-hmm.
So we're pretty much back there at 7:30.
Yeah.
A nurse came in and they spoke with me. Again, a lot of the same questions. I think I signed a few more papers, just consenting to some things. And then they started my IV pretty quickly. To do my IV, they did it in my hand. And she gave me, what was it called? It was a numbing?
It was lidocaine.
Lidocaine.
She did the lidocaine.
Yeah, a shot of lidocaine. And she told me that it was going to like feel like an ant bite, but it was more like a bee sting. So it wasn't crazy terrible or anything, but by the time they put the IV in, I couldn't feel anything at all. So that was good. And then after that, then Dr. Raphael came in, and he marked my chest up. So he just he asked me to sit up real still, and he marked lines. I'm sure they were for his incision lines, and just mapping everything out. So he spoke to me really briefly. I just every time I've spoke with him, he's just been amazing. Just extremely sweet,
super sweet, very reassuring,
yeah,
comforting.
Yes.
He's great.
Yeah, for both of us too. They didn't. I thought it was really great that they didn't just speak to me. They spoke to Alyssa a lot about just how to care for me and be just a good support through it all, which was really appreciative. And the staff in general was just really great with pronouns and using the correct name, because I don't have my legal documents changed yet. So they went out of their way to make sure that they were really good at that.
Yeah, they're great. Great facility.
So shortly after that, then they came in and they started my anesthesia.
Yeah, they put that in your IV, and we pretty much said bye, and you were already feeling it, and they wheeled you off, and that was pretty much it. And it only lasted, it was close to 2 hours.
Yeah.
That I was in the waiting room. It wasn't long at all. I didn't feel like it was long. He certainly didn't feel like it was long. Sure.
No, I don't remember anything from after they put that in. I remember I guess they wheeled me to like a room that was a little bit further back. I don't want to say the back room. That sounds creepy. But and then I remember them asking me to like get from one of the beds to the other bed, and then I was pretty much out after that. So when I woke up, I just woke up in the recovery room, and there was a nurse that was there. I don't remember what I said to her too much, so I don't think it was that embarrassing, but I don't remember a whole lot. But before I knew it, Alyssa was back there, and we were talking, and I just remember feeling like extremely happy. I couldn't believe it was done.
Yeah, you were smiling ear to ear. You're definitely in a good, happy place.
That was cool.
Yeah.
I think they just gave you a little bit more instruction. What would they tell you?
Yeah, she went over each medication in detail, because at the point that we filled the prescription at Walgreens the day before, I was like, what? This is so much. It was 4 medicines. I didn't know what to do with it all. So she went over with me in detail which ones need to be taken with food, which ones cannot be taken together, like at the same hour. And the antibody didn't start till the next day. So she was super helpful and made me feel so much better about doing everything right, especially right there in the beginning, making sure that he isn't opening any doors, because sometimes you can forget, and I know I've heard you say this, is you forget how much you use your arm range, to do just everyday things. So she just made sure that I knew not to let him do any of that kind of stuff. Keeping him elevated on pillows and just the general aftercare. So she was great.
Yeah. So pretty shortly after that, she just kind of loaded me up into the vehicle. I don't think it was too challenging. I was aware enough to be able to like move around, but you definitely didn't want to like move your upper body. So like I noticed that like I've used like my core a lot more, my legs, to try to like navigate and get around. And so I really can't stress enough how important it is to have somebody like that's there for you. I was really grateful to have Alyssa, who could help me and do like a lot of the daily living things that you don't realize beforehand.
Yeah, you really don't.
How important it is. So we got back to the hotel room, and for that first day after surgery, I pretty much slept most of the day. I didn't experience too much like pain like in my chest, really at all. I know a lot of guys. I watched a lot of top surgery videos to kind of prepare myself and know what to expect. And a lot of guys complained because they put what I have on right now is an ace bandage. They put an ace bandage around you, and a lot of guys said that compression was like extremely tight for them, and the most discomfort they experienced was just that pressure in their chest. I've been binding for about 5 years, and sometimes I wear 2 binders whenever I did bind. So I can't say that I experienced too much pain in like the compression. It didn't feel any different than my normal binding, to be honest. But I did get a pretty severe headache, probably about 5 hours after surgery. But that ended up going away. And trying to think of my other complaints. Some itching just from the bandages. Like, you itch and you can't exactly get to it. So that's annoying. And just the limited of mobility will get you sometimes. I know that like at one point my arm had kind of cramped up, and I think it was just from the way I was laying. And a big thing they stress is just making sure you get circulation to your legs. So they want you up and like walking around some, which wasn't too hard to do. You just had to, because you're so out of it, you have to remind yourself to like wake up, and that's where like having somebody there for you is really good to do that. So then the next day was our post-op appointment, our first one for that. So that was pretty early in the morning. What time?
Yeah, 9. We went there at 9.
Yeah, 9 o'clock the next morning. So we woke up and we went up there. And so what they did that day was they took off my ace bandage. And what else?
Yeah, she removed the ace bandage, and then she they actually used maxi pads. It sounds crazy, but they used maxi pads to cover the incision lines all the way across. And she said it's mostly for protection because of the thickness of them instead of just regular surgical pads, I guess. And it's super absorbent, but there really wasn't any blood on there or anything like that, which is super good because he gets really queasy at the sight of any of that. So she replaced those after, she took them off for a little bit, told us some at-home care. He was able to look at his chest, with the exception his nipples still stayed covered in their dressings, with big, huge "do not remove" stamped all over it.
Yeah, which is good. Which was kind of weird, but yeah, I got to see like my incision lines, which I was really, really happy with. To me, they look like really well.
Yeah,
like,
they look great.
They look thin. Everything's not cleaned up quite yet, but I definitely could see them. So that was really, just really exciting. And my chest looked really flat. So
yes.
That was super exciting
Number
as well.
one goal.
But then, after I got to see them, they ended up putting the pads back on and wrapping it back up. So that's what I'm wearing now. Is just still. And so for the next...
We change that once a day.
Yeah.
Same thing, we do that once a day for a week until we go back in 4 days for your follow-up.
Yeah, so in 4 days I'll get to go back for my follow-up appointment. And then I will get to take off the nipple dressings. And so I'll get to see like
Yay.
my entire chest in 4 days.
Yay.
So that's kind of what I'm looking forward to now.
Right.
I would say the pain level relatively is low. Mobility has gotten better. I can move my arms now. I don't try to push it too much. I don't want to stretch my incision lines by any means. I know the only other thing that I haven't mentioned is I got really constipated, which is like kind of embarrassing to talk about, but I'm pretty sure it was like a side effect of the medicine. But besides just the itching and the head I got, that was the only other like pain that and really annoying thing that has happened so far. So that's pretty much my update for 3 days post-op. So I will do another video probably after like I get to see my entire chest, and hopefully like at that time I can probably show you guys. But yeah. You think of anything else?
I think you covered it all.
Okay, cool. Well, if you want to follow me on Instagram, feel free to do so. My name on there is becoming_Heath, and I look forward to making another video and showing my chest to you guys whenever I can.